of look at the health benefits of omega-3. Now, the thing is that there's so many of them. So
yeah, I know.
We'd like to focus. But one thing is, I saw that you did a paper in, I think it was 2021, which was kind of looking at longevity, or I guess all-cause mortality and omega-3 index. So from Framingham. So could you talk a little bit about what you saw in that? Or was it was like a review paper of multiple cohort studies?
It was, it was a pooled analysis of 17 different studies.
Right.
So like Framingham study, I assume your listeners are probably somewhat familiar with Framingham, a classic observational cohort where you just take people when they're a certain age, measure everything under the sun in their blood, et cetera. What do they eat? What do they, everything about them. And then you just follow them for years and years and see who gets what disease. And then link it back to some behavior or some blood level. So we did that ourselves in Framingham and in a women's health initiative study. And then we partnered with 15 other cohorts around the world, some of them in Europe, some in Japan, some Australia, some in England, where they also have a group of people that they measured omega-3 levels in the blood at the beginning of the study and then followed them over time for the development of certain diseases. And the question we were asking in this most recent paper was, is there a relationship between the level of omega-3 in your blood at the beginning of the study and when you die, how long you live, how likely are you to die in a given, roughly a 15-year period of follow-up from people were on average, say 60 years old, 65 years old in this big, we had about 40,000 people. And we followed them for roughly 15 years. So say between age 65 and 75 or 80, roughly. And the question was, who died in that window of time? And we found the people that had the highest omega-3 levels were the least likely to die. Or conversely, with the lowest omega-3, they were more likely to die. And so that held across a wide group of people and we adjusted for all kinds of other risk factors that might have, confounded that. And so it's a very strong predictor. And I was looking at your biological clock studies, and I see nobody's using omega-3 in their little equations, which I think they probably should. It should add predictive value to a longevity predictor.
Interesting. Yeah. Yes. I don't know how they came up with the ones that they have.
Right. Right. I don't think omega-3 was even something that had been measured that could have been into the equation in those particular studies, but that's okay. Somebody will do it in the future.
So if we kind of look at the diseases that affect older people, and we were thinking of like, how does omega-3 help with those? So one of them is definitely heart health, right? It
right.
Definitely. So could you talk a little bit about heart health? I mean, what kind of markers does it improve that you could look at?
The classic marker of that omega-3s reduce or improve is blood triglyceride levels. Blood fat levels is what they're called. Blood triglycerides is one of the two lipids that are commonly measured by your doctor, your cholesterol level and your triglyceride level. Triglyceride levels will be reduced by omega-3, and that's a good thing. Another marker, then there's several things that are typically not measured, like how susceptible or how likely is your blood to clot prematurely. And that's something that omega-3s will reduce, will inhibit what we call platelet function. Platelets are the little cells in the blood that if you have a cut, they all get excited and stick together and plug up the clot. So that's platelet-based blood clotting, and the omega-3s will slow that process down, which is a good thing. Because one of the things that can cause a heart attack is a blood clot forming in the arteries of your heart. And if you can keep that blood clot from forming, then you're not going to have the heart attack. And the omega-3s do that. Omega-3s also do other things like lower blood pressure a little bit. I mean, they're not as good as a blood pressure drug, but they're a nutrient. Okay? But still, chronically lower blood pressure is good. And they also lower the heart rate. which is kind of weird. I mean, it's not obvious why they would do that, but they do affect the balance of the what's called the autonomic nervous system, the sympathetic, parasympathetic. The nervous system controls how fast your heart beats. And omega-3s just seem to calm that down a little bit, slow it down 1 or 2 beats a minute, which over a lifetime is a lot of beats. So those things all play together in some magic mix that causes improved longevity.
Stress is an underlying cause of many health issues. And while most people focus on finding relief from stress through meditation or other forms of mental exercise, the stress may be caused by lack of a key nutrient. Magnesium is one of the most important nutrients for our health because it plays many crucial roles supporting muscle and nerve function. It also impacts the release of stress hormones like cortisol and blocks the activity of stimulating neurotransmitters, leading to a more peaceful and restful state. To ensure that we have sufficient magnesium, my wife and I are taking Magnesium Breakthrough from Bioptimizers. Magnesium Breakthrough has the full spectrum of 7 types of magnesium, specifically formulated to reach every tissue in our body for maximum health benefits. One of the important reasons we chose Magnesium Breakthrough is it's made with all natural ingredients, soy-free, gluten-free, lactose-free, non-GMO, free of chemicals and fillers. To get 10% discount on Magnesium Breakthrough, simply go to magnesiumbreakthrough.com/modern. Use the code MODERN10. Thank you for your support. Yeah, so there was a couple of things in there. So one is so the blood thinning, or at least the lack of clotting, is kind of similar to what aspirin does, but I guess it does, but with less side effects. Would be
right. Less side effects, roughly the same kind of a increase in what we call the bleeding time tests, but yeah, with better safety than aspirin has for sure.
And the other one, yeah, I saw that omega-3 may increase HRV, right? Because it seems very difficult to find a way of increasing your HRV.
I gather your audience knows what that means.
Yeah, the heart rate variability.
Good. Yes. Okay, right. Yeah, and of course you want to have a heart that is heart rate variability does measure how light on its feet the heart is and can respond. And omega-3s have shown increases in heart rate variability, but that's part of that autonomic control of the heart. They also, when people exercise, like on a treadmill, they'll get their heart rate will go up to a certain whatever. And then when you stop exercising, the doctors or electrophysiologists will like to measure your heart rate recovery. How fast does your heart rate go from boom, 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 down back to normal? And the omega-3s, having a higher omega-3 level causes that heart rate recovery to be accelerated, which is a good thing. It means your heart's able to go back down to normal quicker, then it won't stay up long. So there's a lot of things about the heart. We think it reduces the risk for ventricular fibrillation or sudden cardiac death. Although what's interesting is some recent studies have found a small increase in the risk for atrial fibrillation in people taking omega-3 on these big randomized trials at high doses. And that's been a kind of out of the left field. Nobody saw that coming. But, and it's a concern. It's a matter of intense research at the moment. Why is it that omega-3s would do that, would increase risk for atrial fibrillation? Atrial fibrillation is not life-threatening. It's annoying, but it's not life-threatening. I guess the primary thing that could be life-threatening with atrial fibrillation is the risk for stroke.
Right.
And that's why everybody who's got atrial fibrillation is typically on a blood thinner. So they will not form a blood clot in the heart that goes up to your brain and strokes. So, but we've seen, that higher levels of omega-3 are associated with lower risk of stroke. So the worrisome outcome of atrial fibrillation, that is a stroke, seems to be reduced the risk for that is reduced with omega-3. So there's research is never completely clear.
So omega-3 also reduces inflammation. Could you talk a little bit about what we've seen there, and do we know how it does that?
Well, we do know how it does it on a very molecular biology level. Again, it begins with the cell membrane, and as I mentioned, cell membranes they aren't just a little bag of of fatty acids sitting around a cell. They're extremely complicated, and there is on the receptor, or excuse me, on the membrane of every cell is the receptors for that stimulate inflammation. Something's going on outside the cell. It sends a signal to the cell membrane, and that attaches to a receptor, and then that sends a signal inside the cell to turn on anti-inflammatory or turn on inflammatory things. If you got a cut or you got an infection or something, your cell needs to make inflammatory molecules to attack it. That's good. But the sensitivity of those receptors in the cell membrane changes when you have more omega-3 in the cell membrane, so that a signal to start an inflammatory process in the cell is muffled. It's slowed down. The signaling process is blocked a little bit when there's more omega-3. So you don't get this hyper inflammatory reaction, kind of like the COVID story. We've seen that people with high levels of omega-3 are more protected from COVID, which was a paper we published a few months ago. So it's the omega-3s, probably their most important lifetime long-term effect is just to keeping inflammation levels chronically lower. And that helps from the brain to the heart, to the liver, to the gut. Everything is better in joints, etc., eyes. A reduced level of chronic inflammation is good everywhere.